Okay, so we're going to go back to the CAF component, and apologize. The CAF health card didn't get copied and put in the manual, but it is up on the SharePoint site, and it will be on the. It's up on the NAHMS website at the moment under the 2014 dairy questionnaire section, and as probably all the USDA people know, our website got updated last, I guess maybe this week, and so if you're not familiar with how it changed, you may need some help getting back to the normal NAHMS website. If you have problems, let us know. So we're going to go ahead and jump back into the CAF component and the data collectors and cooperators. And like I mentioned, when we first started talking about doing some kind of longitudinal study, we had a couple coordinators that said, that's really a problem because we've got farms that are 4, 5, 6 hours away, and we can't be running out there every month for a year to do this. So we started thinking about what we could do to provide some extra resources, and this is really the list that we came up with. So obviously, if the federal or state VMO or AHT or whoever that federal or state person is can oversee that at the farm and assist them in sampling, that would be great. And then the next option would be to ask the operations private veterinarian through the producer if they would be willing to assist. And we've got a letter that is in the packet to the producer. I'm not sure exactly if it's loose. It's loose in the producer, the American Association of Bovine Practitioners. And so that's essentially it's a letter from AABP to the producer's veterinarian saying, you may be requested to help with data collection in the CAF component of the study, but the farm is participating in the NAHMS study, which is one of the things that AABP asked us to do, was to try to let veterinarians know that the farm they were working with was participating in the study, but they could also potentially participate and help with the CAF component. So that's kind of the second data collector that would help. We don't have any funding to pay those folks. At one time, there was a pharmaceutical company that was willing to put some money toward kind of consulting time, but they've since withdrawn that. As far as I know, I'm still trying to work with them to see if they'll open that back up, so that if the private veterinarian's going to work with their farm, we may be able to get a couple hours of consultation time paid to help with this part of the study. So if federal and state folks aren't able to do it, the operations private veterinarian can't or won't do it, then the next folks, and we've got quite a few on the line today, are the university or extension personnel, and that's really the group we reached out to. And in the materials in the manual, we have a list. I think all but one state has at least one and up to 4 university or extension people in that state that are willing to be contacts. They may not necessarily do the work, but they would know somebody within their team that could help do that. That being said, that doesn't mean that if you're the federal VMO and you're working with this farm and you would like a little bit more of assistance, and it's okay with or maybe not assistance as much as I guess I could see it as a little bit of an education opportunity for either the federal or state person or the operations private veterinarian. The university and extension folks, some of them have said, we're willing to work with anybody to help them to collect this information and then educating producers on calf health. So even though this is the preference that we'd ask that you work with people, if the operations private veterinarian says, I'm going to do this, that's fine, but you can let them know that there's university extension people within their state that are willing to help if they so desire. So if none of those folks can do it, then it really boils down to the operation owner and employees. That's really not the best scenario, because unless this farm is really willing to manage this and make sure that the calves are enrolled and followed and all the information is sent back, that's not going to be a very good data collection process. So I wouldn't, if that's the way it looks like it's going to end up, I wouldn't push to enroll that farm in the CAF component. I just have some concerns about things getting done. When we send out supplies, we thought initially we'll send out all the supplies the farm will need to do their 24 calves, and then we thought about the cost of that and how many farms are going to do it for 3 months or 6 months and then drop out, and we've got all those materials that we've invested in just sitting there on the farm not being used, and so that's why we've kind of changed how we set that up. So does anybody have any questions or comments on this approach to provide additional resources to the federal and state folks? Wow, that was easy.
Hey, Jason.
Oh, I don't want to say anything.
Jason, this is Tom. Just a quick question. The cooperators with the Extension Service, they would come to us as coordinators for the confidentiality forms?
Right. So
Okay.
and that's a really good point, Tom. That I didn't say how the communication would occur, did I? So if you're a federal VMO and you're working with a farm and you need help, you can talk with the producer and see if their veterinarian is interested. If they're not, then it needs to come back to you, really, that the producer needs to come back and say, I want to go to the next level. I want to go to the university or extension folks. And then you would be the ones that contacted the person or people in your state, set that up so that they sign the confidentiality agreement, and then that connection can be made with the farm. But the private veterinarian, I don't think we have to worry about confidentiality because they're already working under some confidentiality as a client-vet-patient relationship. But anybody outside of that is associated with data collection or sample collection on that farm would have to have the confidentiality form completed. And that's really going to fall, I think, to the state coordinator to make sure that that's done.
Okay, and Jason, the letter from the bovine practitioners does mention the confidentiality form.
Right, right. Oh, yeah, some of our legal folks asked us to put that in, but I guess we could have the veterinarian sign that just to be safe, but to me, they're already working they already have a confidential relationship with that farm. But I guess to err on the side of caution, maybe it would be good to have that veterinarian sign that, although I think it's a little bit redundant. Thanks for bringing that up, Tom. I forgot that we were asked to put that in. Okay, so are there any questions so far on the CAF component? I think the only thing we have left is an example of a tracking form that Judy Rodriguez, many of you know Judy, who retired last year, put together for us as an example, and then that can be modified, but we thought we'd go ahead and show it to you and make it available to you. Hopefully we can make it big enough that you can see it. And obviously it'll be in Excel, so you can modify it, but essentially what it does is it has a row to put the calf ID, the 24 calves, when they're born, and then it'll calculate for you what, obviously it's pretty easy with colostrum because that's on day 1, the 1 to 4 day for blood, the 1 to 4 day for ear notch, the 2-week height, and so forth, the fecal. So when you put in the birth date, it will go through and calculate the dates when those other things ideally would occur. Like we said, usually those are going to be fairly big windows other than the weight and height, which we really want to try to get fairly consistently, but that's something that producers or their employees can probably do pretty easily. So we will make this available, but it's just kind of a way obviously you'd need one of these forms for each farm that's participating, and it's just a good way to check off and make sure that all the data and samples are getting submitted as requested.
How will we know that they're getting submitted? I'm not sure how this is useful for us to do. I mean, they're going to be shipping these things off themselves and doing these things, and are you expecting us to keep up with each calf, you're saying?
Well, the producer won't be shipping these things because they're going to have the shipping things that, the boxes and the kits that you order.
Right, but are we going to leave those with them and they would ship them? Are you expecting us to go back for every calf and ship these things off? Is that what you're saying?
Well, you wouldn't have to. You'd have to coordinate that with either the producer or whoever's working with that herd more intimately. But the collection records, for instance, those should be sent to you. So when they fill out the collection record, one goes in the kit and one goes back to the coordinator. So you should be able to tell, what calf samples have been sent.
Wow, and so they're going to be mailing us these things. I guess I didn't see us being on the farm quite as much as now I'm beginning to see that you're saying, or at least as intimately involved with this as you thought, as I thought we were doing.
Yeah, I guess I don't think you need to be on the farm, depending on the farm and how you guys set up that relationship. But you don't, if you're on a farm and they need blood collected, for instance, then that could be worked out that the veterinarian maybe draws the blood or you draw the blood if you happen to be there. I think that it's going to take a lot of coordinating, though, even if you're not on the farm, just to make sure that if the person needs kits, and whoever that person is, if it's a federal field or state field, or whether it's a university person that's doing more of the on-farm managing, then they're going to need to be contacting you to get the kits and things as well.
Jason, can these samples be stored in a refrigerator and sent after so many days or so?
Yeah, and all that's in the calf component of the manual, which is in section 4.
Uh-huh.
The colostrum samples that are collected, and those will be in those screw-top vials that Camilla showed you a picture of. Those can just be a label. There's already, as Camilla mentioned, labels for everything in that first kit, so you can just peel off one of those labels, put it on the colostrum tube, throw it in the freezer. Those can be frozen essentially indefinitely, but the blood samples, which need to be collected from those calves, ideally if those could be spun, that would be great. If not, if we can just store those in the refrigerator. The lab that we've talked to said those can be stored for probably up to 5 days. So that's kind of the window you have if you're going to enroll 1, 2, 3, or 4 calves, and you want to get it all in one shipment box. Then you need to get them shipped out by about 5 days.
Jason, can you speak to, I think at one point you said you'd like them to let us know, because our goal is to get 300 farms signed up. Are they going to need to let us know, and maybe you're going to get to that, when they get farms signed up to participate in the calf component, so we can track how that's going?
Yeah, so that would be the producer signs that, but we don't get that back, right, when they sign up. The producer agreement will have a place where they can check for whether they're going to do the calf component. And we just need to have some way of knowing which farms are doing that. And obviously, each individual state would have to track that. On page 5 of Section 4, the Calf Biologics Manual, actually, let me go to the calf PowerPoint. Camilla's going to pull up the workload estimate for each of the states, and I guess the the thing is, we want to, if a state is not having very good luck enrolling farms in the calf component, then that would be really good to know. We need to do a little bit more with our sample size estimate. The goal was to get 300 farms. I have to make it smaller so you can see the state. So if you're having trouble getting enough farms, then that's something that we would like to know. If you've actually got all the farms allocated, so that's over here on the far right-hand column for each state. If you've got all the herds enrolled that kind of meets your sampling number there, and you have additional that are interested, then let us know, and we can shift some around a little bit too. If we don't get 300, which we think it's probably going to be really tough to get 300, if we don't, we may look at some other options depending on how close we are to 300, and that may involve talking to some of the university extension folks and enrolling some of their farms just in the calf component. So we don't want to do that necessarily, but that's an option we have if it looks like we're not going to be able to get enough signed up in the normal NAHMS flow of operations that come down through that random selection. And there's a little bit more in the calf biologics manual about the time commitment and that kind of stuff. So on page 6 on the collection and shipping schedule, that goes over colostrum. Obviously, the farm can collect that any time. Just freeze it, and then that can go out with blood samples to NVSL. Blood samples can be collected any day because we have that 5-day window that they can get shipped as well. The fecal samples, however, they really need to be shipped, collected and or shipped Sunday through Thursday, so they're asking that you don't collect on Friday and Saturday.
Jason, I think it said Sunday through Wednesday.
Pardon me?
I think the instruction said samples could only be collected Sunday through Wednesday.
Okay, for the fecal samples for the calves, if you collect them Thursday, you just have to ship them Thursday.
Okay.
And that's probably different for the fecal samples for the composite environmentals.
Well, that's what I was thinking of. Okay.
Jason, I got another question, a little different. It was mentioned about putting the calf cards, health cards, in a plastic bag Ziploc and attaching it to maybe the hutch or something to keeping it close to the calf.
Right.
What happens if those cards are lost?
Yeah. Well, we enrolled 3 pilot dairies here, and enrolled 5 calves on each farm, and just followed them. And the farms that had the actual pen out in front of the hutch, those did fine until the hutches blew away. Then we had some issues, but luckily they weren't calves that we had enrolled. The next farm had them tethered, like Frank talked about yesterday, and those weren't a problem until the calves got big enough that we did lose one where they went and they actually chewed on it a little bit, and so we pulled all the others off. So I think that there are some risks of convenience having those right out at the hutch, because what we did is we took all the labels that we needed and we just cut them up, put them in the Ziploc. We had the calf health card, we had the collection records, we had the labels, the weigh tape was in one of them. It was really convenient to just go out there and do the ear notching. The labels were right there to put on the vials. But there definitely is a risk of losing those. It didn't seem like the wind bothered the bags, the snow, the ice, none of that. I'm pretty sure it was calves chewing on it based on the bags that were still there. So it's it's an idea and an option you can use on some farms, but obviously it didn't work as well as we'd like on that one farm. You'll kind of have to play it by ear and see how things go.
Yeah, I mean it sure sounds good to have the convenience of that right there, but I don't know how practical that's going to be. But the question is, what happens if you do lose your cards after 3 or 4 months? You lose one or something.
Well, I don't. Yeah, Abby says we try. Yeah, that's a good point. I mean, if you're concerned about that happening on a farm, then I think how you manage those are just going to be different than we did. And I've seen those before where people have just taped them, and that's why we tried it. And like I said, it worked really well, except on those hutches where the calves could get to them.
Yeah.
And this is Tom. I think any one calf card's only got to stick around for 2 months.
2 to 3 months, yep. That was the problem. This farm weans at 3 months. So if we'd have made 2 months, if they'd have weaned at 2 months, we'd have been all right. But those calves are 2.5 months, and they got big enough and got to the back of the hutch. But that's a really good point. It may work on some farms. We did lose one of the calf cards that we had going, blew away, and it wasn't such a big deal because it wasn't officially enrolled in the study. But we'd been on that farm every week for 9 weeks, recording weights and stuff on that calf, and we lost all that. Any other questions on the calf component?
Yes, Jason. Did you have experience to go to the calf raising operation following these calves? Because most of these dairies send their calves to calf raising operations.
That's a good point, Cyrus. And we did talk about that, and we decided that yes, if the farm sends calves to a heifer raiser or calf ranch, that and they're willing to collect the information and do what we need done, then yes, those calves can be enrolled.
Well, my question is that did you have experience? How did it go?
We haven't had any experience with that.
Okay.
None of the farms we work with around here locally send baby calves off.
Okay.
But we're sure willing to try that if we think it'll work.
Well, that actually is another reason to reduce the total number, because they are so busy they don't want to fool around with extra work.
Calf ranchers?
Yeah, who doesn't want to fool around with that?
Calf raising operations, because they just don't have any sympathy for the owner to do some extra work.
Yeah. Well, like I say, that's something that's got to be worked out between the producer and their calf raiser.
Yeah.
If they don't think it's going to work, or if the calf raiser's not willing to let it happen, then that's we just. I think there probably would be some farms that would.
Yeah, that's true, but that reduces the total number for each state, if in case you have so many calf raising operations.
Right. So one of the options that we've thought about, especially in states like California, where we've got a fairly high number of estimated calf or operations enrolled in the calf component, we may look at increasing the number of calves per farm.
Okay, then
and maybe we can keep some of those that stay at home and don't go off to the calf ranch.
Okay.
This is new territory, really. I mean, the last time we did a longitudinal study was 91, 92. Maybe some of you folks were around. I wasn't around. I know that there were some good things, and there was a lot of good information that came out of that study. I'm sure it was very difficult in terms of the resources needed to get it done. I guess one of the reasons that we had the speakers yesterday and today is to kind of reiterate that the things that we do as NAHMS, we don't just come up with on our own. these are things that the industry and experts are telling us is important, and we really are the only group that has the capacity to go across multiple states and gather this type of information. We don't know. We have a lot of faith in our field force that if we put something together and we had a lot of input from the field on putting this together, that you guys will do your best to get it done. If we don't reach our target, we still know that you've done the best job you can, and we'll look for ways to make sure that at least we get enough data to answer the questions that were asked of us.
Jason, this is Lynn. I'm just curious. Have you tried to make any time estimates on how much this is going to, how much time you think each farm will take? I mean, I know it's really difficult, but I'm just curious if you had to justify this in any way.
Yeah, we did in our OMB package. I don't remember the time off the top of my head, but it's at a per calf, on a per calf basis, and it doesn't include any travel.
Uh-huh.
But that's one reason why we still saw this as a really two benefits, maybe three benefits of this calf component. One is that we could get a lot of this information that the industry said is important in terms of health of pre-weaned calves and look for associations with other management practices. The other benefit we thought is that, as was mentioned yesterday, when somebody comes onto a farm and starts focusing on something, that automatically changes behavior on that farm. So if we say we're going to come in, we'd like to come in, we'd like to work with your calves, we think they're really important, we need to collect this data, I think that helps educate the producer that, yeah, this is something that is important. I mean, you really convey that message to them when you go out and say this is something we should study. So hopefully, the other big thing, other than getting all the data and looking at this, is if we can improve calf management on 150 farms, man, I would call that a success. Obviously, we have to have some data to go along with that, but I think educating the producer, getting the data, and then and finding out what's going on and how we can improve that. And then the third thing is education of other folks, whether it's the veterinarian that's working with the farm that hasn't focused, as Frank talked about yesterday, they really haven't focused on the calves because they're always behind the cows. Well, this is an opportunity when the behind the cows stuff is starting to go away, that they could jump in and with the assistance of other folks, university extension folks that have a lot of experience working with calves, they could actually get some information and education on how they can do a better job of managing their clients' calves too. So I think there's a lot of benefits. The downside, obviously, is the amount of time that it may take to pull this off. So I think it's good that there are concerns because Bruce is a little skeptical about this component as well, and I think we're all a little nervous to see how it goes. But like I said, we have a lot of faith. I've really been impressed with the university and extension folks that have stepped up and said, we're willing to help however we can. I mean, we may not be able to do everything you ask, but we're sure willing to give it a shot. I know the folks in California have already started working with you, Cyrus, on trying to figure out how you guys can work together, and if they're going to be doing some of the VS visits and helping you out, then I think that's a great opportunity too. So I think there's a variety of different approaches that can be taken, and we just need to be a little creative. If we can't make it work, though, we just need to communicate that and try to work out a solution.
So these calves actually are monitored only for day 1 to the weaning age. After the weaning, that we are done with them. Is that correct?
They're done, right?
Okay.
Yep. Okay, any other questions? That was good. Good. I'm glad you guys brought those up, and hopefully we addressed them at least enough to make you a little bit more comfortable. Any other questions on the calf component?
This is Greg Schmidt from Iowa. I just had a question. It looks to me if the VMOs or AHTs are collecting some of this information for the calves. They're going to be on the farm pretty much once a month. Is that correct?
They could be, yes, as they're enrolling calves if they need assistance with the technical aspects of drawing blood or ear notches or something like that. I think that's really something that's an individual. It's individual based on the farm and what they're comfortable doing. They very well may have someone that's comfortable drawing blood and doing the ear notches. I know most of the farms around here, they would have personnel that would be skilled enough to do that.
Okay, so we could arrange it so that someone on the farm themselves could take some of these samples, and do they go ahead and send them in, or do we send them in?
That, I think, gets back to that individual arrangement that you might have if you're not going to be there, or if it's on your way somewhere and you could pick up the samples and make sure they get shipped off, that's fine. If not, all the stuff is there and you could just explain to the producer what they need to do and mail it. I think that's fine too.
I see. The other question I had was, if we're asking them to collect a colostrum sample, would that kind of skew how they administer colostrum? And I'm assuming if they collect the colostrum sample that they're going to do a better job of feeding a calf.
Yeah. That gets back to changing behaviors. If somebody's if they're going to get feedback, maybe they'll say, oh, this is, now, granted, they may focus on those calves that are in the study, but I think that eventually people go back to either doing what they used to do or they start a new habit.
I agree. I think it's good for the calf anyway and for the farm.
Right. Right. And I think Sheila talked a lot yesterday and addressed some of the things that if things don't make sense. So and this may be where the university extension folks, the private veterinarian may have a little bit more insight after visiting the farm. But if you've got a farm and you're getting back calves that have IgG of in the 1,500 to 2,000 range that Sheila was talking about yesterday, and you've got disease all over that farm, there may be an opportunity to do some talking about those sick calves, but that would be a hint that what's going on with the colostrum in this calf, or these calves that all seem to be way above normal. Not that disease can't override immunity, but I think as you get on the farm and you start seeing things are going to either make sense or they're not going to make sense over time.
Okay, thank you.
And I don't have all the answers to all these questions. I think that the university extension folks are a great resource, and a lot of those folks have tons more experience with calves than I do. And that's why I tried to get them on board, because those are really the experts that can make a difference on the farm.
Also, I want everyone to know, Jason's always available, Abby, Camilla, for questions throughout. It's hard to grasp everything we're probably putting out there in these 2 days, but they're available for questions if things come up that you have, want addressed. They'll be happy to respond to questions throughout the study.
And this is complicated. It took me a long time to kind of convey my message of what the industry brought and what we came up with in terms of this component back to the NAHMS staff. And I think they were very skeptical for a long time, but as we started going forward and having more calls with folks, that people warmed up to it a little bit more. But it does take a while to wrap your head around it. And once you get on the farm, and I think you go through enrolling a calf and go through the health card and talk to them, at least my experience with the 3 dairies we piloted on here in Colorado last fall, it's not really near as overwhelming, but you just have to get in and do it to see actually what it entails. All right. So as Virginia said, if you still have questions or questions come up, don't hesitate to pick up the phone, shoot me an email, Abby an email. We're more than happy to try to answer your questions, work with you to make things happen. So just let us know. So if we can, we did get the video, the lameness video. It's a 7-minute video. Go ahead and play that. And then this was compiled by a PhD student, Ashley Adams, that's working with us. She's doing her PhD on welfare in dairy cattle. And so I've kind of given her the welfare objective and the lameness objective to take on as their PhD project. She put this video together, and we'll go ahead and show that to you. And like I said, we'll make that available on SharePoint and CDs for those that need CDs, and also on our NAHMS public website. So Camilla's pulling that up now.
I have to use that microphone.
Over here. Okay.
So you guys will have to let us know if you can't hear this.
Welcome to the lameness detection training video for the upcoming NAHMS Dairy 2014 study. This video will describe the 3-point lameness detection scale that will be used in the study, will illustrate each of the 3 lameness scores through video examples, and will end with a self-assessment that will allow you to evaluate your performance when using the 3-point lameness detection scale. The 3-point lameness scale is made up of 3 different lameness categories. Sound cows are assigned a score of 1. Mild moderately lame cows are assigned a score of 2, and severely lame cows are assigned a score of 3. Cows with a lameness score of 1 are considered sound. There is no visible gait abnormality to a very slight gait abnormality. These cows walk smoothly and comfortably with long strides. Older cows may have a bit of an arch to their back or may walk slower than other cows in the herd, but their movement is still free of obvious discomfort. Another way to think of cows with a lameness score of 1 is that they are in no need of being examined by a hoof trimmer or veterinarian. If you find yourself thinking that a cow needs to be evaluated, then she should be placed in one of the other lameness categories. Here's a score 1 cow. She walks comfortably with long strides. Her rear foot comes close to her front foot before she takes a step, which is referred to as tracking up and is seen in sound cows. This is an example of an older cow that is scored a 1. She has a slight arch in her back, but walks comfortably with long strides. Cows that are mild to moderately lame are assigned a lameness score of 2. There is a visible gait abnormality, which may include a shortened stride length, which is obvious by an increase in the space between their rear and front foot placement, a head bob, and or an arching of the back. These cows appear uncomfortable when they walk and will possibly walk more stiffly than sound cows. The affected limb is not likely to be obvious. These are the cows that may be missed by a novice scorer, such as a dairy employee, but they are lame despite the fact that they are not obviously favoring a limb. Again, considering whether or not a cow needs to be examined by a professional hoof trimmer or a veterinarian may help you to categorize the cows. If you feel that a cow should be examined soon to identify why she's walking abnormally, then she should be scored at the very least of 2, with the more severe cases being scored of 3. Here's a score 2 cow. She is walking stiffly and is not tracking up. Notice the space between her rear foot and her front foot. Also note the arching of the back and the slight head bob. Severely lame cows are assigned a score of 3 and are cows with an obvious gait abnormality, which may include shortened stride length, prominent head bob, and or a pronounced arching of the back, with cows favoring 1 or more limbs. These cows will be hesitant or refuse to bear weight on the affected limb, and walking may be extremely difficult and painful. As a general rule, when interpreting head bobs, cows with a front foot injury will bob their heads up when placing weight on the affected foot, while cows with a rear foot injury will bob their heads down when stepping on the affected foot. These cows tend to walk slower and frequently end up at the back of the herd. Lameness score 3 cows tend to be easily identifiable as their gait abnormalities are quite obvious. These are cows that need to be examined by a professional hoof trimmer or veterinarian immediately to assess the animal and to determine the proper course of action, and are also cows that are of greatest welfare concern, as these animals appear to be in pain and are obviously uncomfortable. This cow is a 3 and is lame on her right front. She is short striding and her head bobs up as she steps on the sore foot. Now we'll show you examples of cows in each lameness category and score them with you. This cow is a 1. This cow is a 3 and is lame on her right front. Her head bobs up when the right foot is impacting the ground. This cow is a 1. This cow is a 2. She looks stiff, has a slight back arch, and a subtle head bob. This cow is a 1. This cow is a 3. Even though she stands with a flat back, she is obviously favoring her right rear foot. It's why it's important to score cows as they are born. This cow is a 1. This cow is a 2. She walks stiffly with an arched back and a head bob. This cow is a 3. She is favoring her right rear foot and her head bobs down as she places weight on the affected foot. This cow is a 2. She walks stiffly and is short striding. The affected limb is not obvious. Now we will show you examples of cows, and it will be up to you to score them on your own. So grab a piece of paper and jot down your scores, and we'll
So we're going to go ahead and stop it there. The next part is the self. Maybe we'll stop it. We noticed that the video doesn't show up near as clear on Food Shield as we hope, so it's really hard to evaluate lameness on cows that are kind of choppy like that. But that's the training part of the video. The self-assessment goes through 20 cows that are scored, and then at the end we give the scores that the experts came up with for those cows. So the YouTube version of that is much smoother and easier to see.